Hello and welcome to this Wound Care Today Facebook Live seminar. My name is Justine Whitaker and I'm Nurse Consultant and Director of Northern Lymphology. Today we're going to focus on measuring and ordering via prescription, fitting and aftercare of compression hosiery for the lower limb. This seminar is kindly supported by Daylong. At any time during this seminar you can submit me a question by commenting on the video and I'll do my best to answer as many of your questions as possible at the end of this presentation. After this event you can access your certificate of attendance which will contribute to your revalidation and your CPD hours. I want to move on to the presentation now because I've got loads of really exciting stuff to share with you. So firstly I want to introduce you to MOFA. And MOFA is measuring, ordering, fitting and aftercare of compression hosiery. And today we're going to concentrate on talking about the lower limb. So hopefully by the end of this seminar tonight, you're going to hopefully have achieved one, if not four, of these learning objectives. And the first one is to have a clear understanding of how you measure compression garments correctly. Secondly, I want you to understand what's required when you have to fill in a prescription form correctly when ordering your garments. And thirdly, to be able to teach your patients or their carers the correct application of a garment. What to do and what to know after you've got these garments and the aftercare and what's recommended for patients is really important too. And this is where I'm going to give you some top tips and hopefully a few little pearls for you to take home later on tonight. So let's understand how to choose which type of compression garment you want to use. Well, firstly, this sits with your patient. We need to know their history and their background. It may be somebody you've been looking after for a while, or it could be a new patient for you. So important to understand where they are on their journey with their disease process. Differential diagnosis underpins everything that we do. We need to consider the lymphatic system, the venous system, the arterial. Are these patients mixed etiology? If we're looking at the venous system, where are they on that disease stage? Have they got varicose veins? Are they hereditary? Have they had a leg ulcer? Have they got a leg ulcer? All these different phases of disease will give you a different reason for putting different compression garments on. If we consider the lymphatic system, we need to think about the size and the type of tissue that we're going to be applying the material to. But let's just talk briefly about the arterial system. It is briefly because this is a presentation in its own right. We do, like in any other situation when we're considering compression, need to look at the Doppler signals and consider doing an ankle brachial pressure index measurement. For those of you that work in clinics, you will have these in your systems and you'll need to use them. If you're a patient watching this, you may already be familiar with the blood pressure cuff on your calf and the Doppler sound listening to your heartbeat in your foot. If I could just draw your attention to the British Lymphology Society, they've just produced some really good clear guidelines what to do with patients with lymphedema, a notoriously difficult group to get an accurate ABPI on. So if you go to their website, you'll be able to download their recent guidelines that have just been published and you won't be disappointed. So again, we need to think about how to choose what type of compression garment to use. This is individual for each patient. It's not they're at this stage in the disease, they've got to have that. Lots of other things come into play when we're looking at this. And also you need to think about what you want to achieve as a healthcare professional to help the patient get the best outcome of their care. Thinking about what pressures you need to put on when you're using the compression is vital to understand what we need to use. If you've just been working with a patient who's been bandaged for several days, weeks or even months, and this could be because of healing a venous leg ulcer, or it could be for reducing limb volume, reshaping and debulking a limb in lymphedema, you're likely to have been using really quite high pressures with a stiff bandage over 24 hours a day over a longer period of time. Is it right that you then go into a light compression class stocking because it's just easy to put on if you're wanting to maintain all the work that's been done for just say 8 hours a day? It's not just the compression that we need to think about. Because we've been in bandages, then we might need to think about the stiffness of the material that we're going to be putting on these patients. It comes together and they're not separate. but what are the patient's and carer's circumstances? Are they able to apply compression garments themselves? There's a huge array of products out there now which are tailored to individual needs. But most importantly, if you're a clinician, you need to remember your personal competencies. Please don't go out there and doing this for the first time on a patient without any support and guidance. All the manufacturers offer a huge array of education and support, and they'll come and visit you in your clinical setting to help you do that so you can get it right first time with your patients. So how are the garments made to get the pressures and tensions they apply? And how do the manufacturers test these garments as a recognised standard? Well, that's quite a big question, and it's not an easy one to answer. So I'm going to try and take you through some really basic steps on this so it helps you get a grasp of what's out there, which will then ultimately help you choose the best garment for your patient. So if we look at these three different categories, we've got the way they are made when we're looking at the different yarns and how that then comes together to make the whole prescription. So the components to consider are the type and mix of yarns and the manufacturer's weave of the garment and the fabrics that they're using. If we look at the top one, number 1 first, we can see we've got an elastic circular knit or a mesh type fabric. And I have an example here to show you, which is sort of highlighting the mesh. And you can see here how elastic and stretchy this is. This typically would be what we'd be talking about if we're looking at a British standard class 1. The second one, we're looking at an elastic circular knit again, because of that, the way it's made, it's like a mesh, but it also has an inlaid yarn. And you can see we've still got elastic, we've got a good stretch in there, which means that when it's put on the limb, it's going to go back down to work those forces on the skin. But this has an inlay yarn going the whole way through it in a circular way. The third category is our flat knit weave fabric. So this is this type of garment that we're talking about, and you can see here that these are knit flat and they're woven properly knit on a machine in a flat way, and then they're sewn together with a seam, which then on the inside lays quite flat against the patient. This has both inlay yarn but also is created to be more inelastic in its stretch, so it's much stiffer. So let's just go into a little bit more detail. We can see the body yarn here depicted in yellow, and this together comes to make up the thickness and the stiffness of the product. It's the weave that's made. You can see it weaving in and out of each other. And together, if we look again at the inlay yarn of B, it's responsible for the compression pressure. So these two together are not separate because they're intertwined, and they give us the full total prescription or the dose of what's required when we're applying compression. So this is giving us compression and stiffness together, and it's these two components that actually give us what we're required within that prescription for a patient. Now this is a chart that some of you may or may not be familiar with. Each country has its own different pressure for its classification. So in the first column we see the word compression class, class 1, class 2, class 3, class 4, all terms that we're very familiar with. And we may take somebody out of a bandage and we may say, oh, we're going to put them in a class 2, or we're going to put them in a class 3. Or we might just put them in a class 1 because they're not very good at putting a stocking on themselves. But what I want you to think about is the different pressures that each country produce their garments to. And if I highlight the first class 1 section, in France, which is often referred to as AFNOR, we can see that range starts at 10 to 15. But if we then go into the European standard or the RAL standard, it goes as high as 21. That's an increase or a difference of 11 millimetres of mercury, which is quite a large amount of pressure when you're thinking about where the start point is with the French garment. Again, if we go on to class 2, we can see here the start point, particularly on the French one, is a 15 millimetres mercury, but on the RAL standard goes up to 32. So we've got a difference of 17 millimetres of mercury. So already you'll be able to start to get the picture that if you're thinking about putting a class 2 on someone, Where is it coming from? Because a difference of 17 millimetres of mercury is the equivalent of putting a class 1 stocking on. But it gets even greater when we start to go up the range, because on a class 3 stocking we can see the difference of 26 millimetres of mercury. So I'm going to put this back to you. I want you to think about, should we be talking about the compression class when we're thinking about what we're putting our patient in? Or should we be thinking about the value of pressure that we want to put on that limb to get the right outcome for that individual? Because each of the different countries offer different ranges of compression and they're not guaranteed to be the same. So how do manufacturers test their pressure? Well, for instance, if we've got a garment, if we use a 20 to 30 millimetres of mercury, for example, it's tested using an apparatus called a dynamometer. And I've got that right for the first time in rehearsals. It's a generic name for a piece of kit that measures the strength, the pressure and the stiffness of a fabric. And the common names for some of these that some of you may or may not have heard of are Hatra and hosiery. There are others, but I'm just mentioning these two for now. These are then translated into RAL, European, British, French, which we're commonly referred to as test norms and standards. No one of these is better than the other. It's the actual manufacturing test, not a highest or best pressure test of what's going to be on the limb. So if we start with our acronym MOFA, we start with the letter M and we're going into measuring. So we need to know what we're measuring for. When we've done our assessment of our patient and we understand what pressure we want to put on them, we then need to decide whether we're going to be able to put them in an off-the-shelf garment or a standard garment. If we're not able to get them in those from a sizing perspective or unavailability, then we may need to consider a made-to-measure garment. Now, most people think of a made-to-measure garment just being flat knit, but indeed you can get a circular elastic knit garment as well on a made-to-measure prescription. One of the main reasons or considerations that we have for going into made-to-measure is to look at the shape of the limb. That's often something that dictates whether somebody goes into made-to-measure or not. Remember, when choosing the style, we need to think about below knee, thigh high, and where possible, if there's any edema, we need to take the garment above the swelling. If somebody's leg is swollen to the knee, we wouldn't generally put them in a below knee. We'd take them into a thigh high. And also if somebody's got a venous disorder and they have a huge swollen vein or varicosis in the thigh area, it doesn't make sense to put a below knee garment on where you're going to start nipping those vessels together and in essence cutting off that venous return. It's going to increase the pressure and ultimately potentially cause phlebitis in the thigh. So think about the overall limb and what garment style you're going to be choosing. The patients then have a choice as to whether they want an open close or a closed toe. You may need to guide them for that as a professional for various reasons, such as fungal infections of the toes, or it may be in summer they like an open toe, in winter they like a closed toe. The other options that are available as standard as well are on the grip top. The made-to-measure garments have got a huge range of optional extras. You can have them with feet, without feet, with waist attachments, with zips, with silk pieces sewn into creases in the ankle and the knee area. There's all sorts of options, so you need to consider all those choices. So how do we measure? I'm going to take you through how to measure for a standard size garment, and there's some key measuring points regardless really of which manufacturer you're using, but I would always emphasise that you look carefully as to which company garments you're using and relate back to their measuring chart. What I'm going to do now, rather than talk you through this slide, is show you a video on exactly how to measure for a standard off-the-shelf garment. So we're going to show you how to measure an off-the-shelf standard below knee stocking, but before we do that I just want to make a point about the different tape measures that are available. This one here is a pre-tension tape measure that we use when we're doing limb volume in lymphedema, and it's commonly kicking around every clinic, but it's calibrated to the calculator that you use to do your limb volume measurements and not calibrated to the manufacturer's guidelines when you're measuring for garments. So this is a no-go tape measure, and what we need is just a standard tape measure when we're measuring for compression garments. So the equipment that we need when we're going to be measuring are your standard tape measure, a pen, or I use an eyeliner because it's easily removable and generally hypoallergenic. So when we're measuring for a standard garment, we need to consider the length. Manufacturers generally produce them in petite or short, standard or long. So we need to measure from the base of the heel to 2 centimetres below the knee crease, and that will give us the standard length for a below knee stocking. So what we're going to do to start with, we're going to concentrate on the circumferential measurements. And as you can see from the previous slide, we're going to be looking at a CB point, CC and CD point. So we're looking at 2 centimetres above the malleolus, or the narrowest part of the ankle, the widest part of the calf, and then 2 finger widths below the crease of the knee, because that's where you want the stocking to finish. If you take the measurement in the crease of the knee, that's where the stocking will end, and that's where it's going to get uncomfortable for the patient. So we're going to use our eyeliner to measure up for this on these points. So we take from the centre of the malleolus 2 finger points and we draw a line on the limb. We then go to the widest part of the calf and we place the line here. And then we ask the patient to just gently lift up their knee, place your 2 fingers, and you can see here, there, you would make your line. Okay, so we take our tape measure. I like to have some patient participation at this point in the game, and also it encourages people to be involved in what we're doing. So at this point I'll be asking the patient to write down the numbers that I'm going to be giving and reading out. So if we place a tape measure here and then just lay that over with a slight amount of tension, we're not going tight and we're not going slack, we just need enough tension to have some torque on that vessel. And we're going straight in here at 23 centimetres. So at this point I'd ask my patients to write CB 23. We're then going to move up to the leg, to the CB, and I'm going to get the patient to relax their calf so that we're not flexing. There's a slight dorsiflexion still on the foot the best they can, but then we've got a good tension around the calf, and we're going to then measure again with some tension, and we're going in at 38. And then we're just going to slide this up and we're going to relax the leg down again, and we're going to go for CD, and again we're going here, and that's coming in nicely at 36. So we've got our 3 standard measurements. We then need to take the measure with the ruler to get the length for the patient. So we're going to be going from the base of the foot to point D. So here we've got, that's 45 to this point. And then we're going up to the base of number CD, and we've another 5 centimetres. So the length of this leg for the standard size would be 50. So we would need to look at the manufacturer's chart to see which category that was, either petite, standard or long. So if we needed to go above the knee, we would need to consider where we want the stocking to finish at the thigh. If you're ordering a garment that has an optional grip top, then you will need to consider where that end of the grip top is going to finish, not below the band. And what we ask patients to do is just ease forward if they're on a couch, or if they're standing, we can get them to do that. But what we would do here is 2 fingers or 2 centimetres below the gluteal fold, and not go from inside the groin, because that will give us the band around the top of the thigh, and we would mark and measure it in exactly the same way as we've just done for the lower leg. So we've just gone through the video showing you how to measure for a standard size off-the-shelf garment. What I want to bring your attention to now is, how do we go about measuring a made-to-measure garment? These appear a lot more complex, but actually there's not much difference. I'm going to show you a short video now on how we do a made-to-measure garment, and hopefully by then you'll feel a lot more confident to be able to do that yourselves. We're going to talk through now how to measure for a made-to-measure garment when you want your patient to have a bespoke garment that is only fit for them. Where we measured the length on the standard compression garments, we measured for a below knee the full length and for a thigh from thigh to foot. With a made-to-measure garment, we measure the points B, C, D, etc. for the length at a time. So I'll show you exactly what I mean with that. And again, this is where we have our patient participation. So for instance, we will measure the ruler to B here, and we at this point would get the patient to write down 12 centimetres. So floor to B is 12 centimetres. Floor to C is 40 centimetres. And then floor to D would be so on and so on as we go up the limb down to the base. Because with a bespoke garment, they need to have the length to know where the point is that they're making that circular knit. So I'm just going to talk briefly about the length of the foot when we come to measuring. If we would like an open toe garment, then we need to take from the base of the heel up to point A. Some manufacturers give us the option of a slant foot, so you would need a lateral and a medial measure, and the medial measure would naturally be higher than the lateral measure if you wanted the slant. If you wanted to measure for a closed toe, then you would take from the base of the heel to the height of the great toe, and that would give you the foot length for the measuring for a closed toe. So to start taking our circumferential measurements up the leg, we start with point A and we measure around the base of the toes. Our next point is the only point that's not got a length or a circumference, which is called the Y crease, and it's taken from the heel across the front of the foot with the foot dorsiflexed. So I'm now going to show you how to measure the Y crease, and first of all we ask the patient to have their foot in a dorsiflexed position, and then just to ease their heel up ever so slightly, relax down, and then we bring the tape measure up and over the front of the foot, and we get the measure at 35.5 millimetres. This measure is particularly useful for a reasonably shaped ankle. However, for the patients who have lipedema with a normal tight dorsum of the foot, but then start to protrude out with their lipedema around the ankle, or for patients who have a lymphedema with an ankle overhang, this measure can sometimes be the difference between it nipping in the ankle or not. So a top tip to alleviate that problem is to just alter the angle of the tape measure very slightly. And what we do there is, instead of going across, we do a V, and we just come up slightly, and here we're coming in at 36. So we've just seen how to measure for a made-to-measure garment. I think the two differences really are that you add in the F measurement and the mid-thigh, but also you measure the length for each circumference that you're going to take. Hopefully you've enjoyed the little top tip on the Y crease as well for those more difficult ankles. But that's tailor-made. So going back to the standard one, when we measure somebody, what happens if they fit into 2 or 3 different sizes? It nearly always happens, and then you're in the dilemma of, oh, should we put them in this size or that size? Well, I'm going to help you understand which size to choose. So again, if we take a compression garment, there's 20 to 30 millimetres of mercury compression. This is what the manufacturers tell us it is the pressure, that range at the ankle. So if we look at ankle, which is the B point, and we take a circumferential measurement and it's 21 centimetres, we then go to our manufacturer's sizing chart and we see a size range is 21 to 26. We can therefore presume that approximately 20 millimetres of mercury will be exerted at the ankle if you're at that lower end of that size range. However, if your ankle is at the higher end of that size range, it's going to be exerting approximately 30 millimetres of mercury at the ankle. So if we then start to measure up the limb to see what other size, so we know which size there would be if we measure at the ankle and what pressure we're wanting to exert there, we then need to consider measuring them at B, C and D if we're looking at a below knee garment. So we've established that the patient fits into a normal size ankle range at B. And then when we go on to measurement C, which is the widest part of the calf, we can see that it's at the higher end of the spectrum in that size range. But then when we go on to measurement D, it's off the scale. It doesn't fit in, it's jumping 2 or 3 sizes up. So you're probably looking at a limb that's this kind of shape. So what do we do? Do we make a made-to-measure garment, or do we consider a wide calf option? More and more manufacturers are offering this option to keep somebody in a standard size with a wider calf. And don't forget about the length. Always remember to understand when you're measuring the circumference on an off-the-shelf garment to know whether the patient's in short, standard or long, and it's a one-off measurement, and you'll need that for ordering and prescribing. So what next? Well, we've measured and we know what size, we know what compression class, and we've now decided what type of compression we want to order. So all that needs to be done now is to order them. So we're going on to the O of MOFA for ordering. And this can be done in 2 ways in a clinical setting. We can order direct from the manufacturer or wholesaler, and we would have drug tariff price plus VAT, and we can do that for one-off individual orders, or we can as a clinic hold a stock of garments, so we buy a stock in and that same deal occurs. Or we can then prescribe individually for each patient on FP10. These are VAT exempt, and it's a drug tariff price and there's no delivery charge. It's this latter ordering group that I'm going to concentrate on because this is where we're seeing the most variation. So there are 6 kind of golden boxes to tick when we're considering writing a prescription for a patient for a compression garment. Brand and type of garment, the class of hosiery followed by the pressure measurement, the colour, what style you would like and the length, and also the quantity to be dispensed and the optional extras. Now if you are using optional extras such as in made to measure, it's pivotal that you put those codes on, because if you don't put those codes on, there's no reimbursement from the companies with that. So let's look at a circular knit off-the-shelf garment, for example. And this prescription sheet requires these 6 areas to be looked at. So ABC would be the company or the brand that we're looking at. And for instance, we're going to say British Standard here. So we would put class 2, but we'd also put the compression value at the side, which is 18 to 24. We want to choose the colour, and in this instance we've chosen black. And we want the patient to be in a below knee garment with an open toe. And the size here says large. If you don't put the length of the garment, the standard size will arrive. So you may need to write petite or small, large or standard. But if you leave it blank, a standard one will come. And we want this patient to have 2 pairs, 2 times pairs. So we want 4 stockings in essence. So how does that equate to then costing out the cost of a prescription once that's filled in? Well, if we're using a British Standard hosiery, it's charged by the items in the box. So one box has got 2 garments in it. It therefore has 2 prescription charges. And as we're going live today, currently the prescription charge is £9 per item. So if we're ordering one box with 2 stockings in, we've got a charge of £18. However, if we're ordering 2 pairs, we've then got 4 stockings and the prescription charge jumps to £36 with British Standard hosiery. If we then look at, for example, writing a flat knit or a circular knit made to measure prescription, we need to look at probably handwriting this script. And before we read this out, the most important thing that accompanies this script is the measurements you've just taken in your clinical setting that you've seen on the videos. Otherwise, this garment cannot be made. We need to put the name of the company of the stocking that we're using, and we need to write made to measure. We need to put the compression class, and again, we need to put the value of that. We need to choose the colour, the style, and of course we've mentioned the optional extras, but again I'll reiterate, you need to write the codes of these on the prescription, which is why this script is in purple and generally handwritten. So if we order 2 pairs of this garment or 2 stockings, we've got the same prescription. So how much do these ones equate to the costs of things compared to British standard? Well, these come under a lymphedema garments category on the drug tariff, and the garments ordered must be the same, so either stock or made to measure. Optional and extras are part of the garment, and any charges are not then passed on to the patient on the prescription, but then still required for reimbursement. But there's no limit to the quantity for the prescription charge. So if we've got one prescription that's asking for 4 garments, we still only pay £9. If we have a prescription for a made to measure and the patient wants a sand colour and a black one to alternate, we then generate 2 prescriptions. So the cost would be £18. So when you change anything at all within that prescription, it changes the value of the prescription. So if it's exactly the same, it's one price. If there's any changes, it goes to 2. This will actually have an impact on the patient. And you may need to, financially I'm saying, you may need to advise them to buy a prepayment prescription certificate. If you get them to send this in, if you're going into a pharmacy, they'll need to take this in with them. If they're sending their prescription away to a specialist dispenser, the certificate code will need to be written on the back of this prescription. The back of the prescription must be filled in properly, otherwise this will hugely delay the delivery of the garment, and there'll be lots of to-ing and fro-ing and phone calls and posting, and this can delay things by not days but weeks for the patient. So really filling in these forms is absolutely vital to the standard that we've just explained. There are a lot of challenges in getting the garment, and a recent survey that was done last year showed that 57% of all the clinicians, and there was over 600 people filled this in, experienced problems caused by garments being supplied incorrectly. Now if we look at that number, that's 57%, and that breaks down to the 2 categories of it being the wrong size and the wrong garment being ordered. So those 2 to me are the 2 kind of danger areas, because they're the ones that can harm the patient the most. So if they're in essence a drug error and need to be documented as such, but what's more important is that the patient's not harmed through this process. But that's a huge amount that people are incurring on this. And that's not to even consider the economics of over 50% of people having the wrong gear. That's a lot of money out of the budget and could have implications in the future. 76% of all clinicians questionnaire estimated that they have issues in waiting for the delivery of these garments. And as you can see from this graph, it's a huge waiting time. We're not just talking days of the weeks, we're talking working days of the weeks. So the majority of people are waiting between 2 and 3 and sometimes over 3 weeks for the delivery of the compression garments. And that's due to some of the problems that we've just highlighted. But that again has huge implications, not just to the clinic. If you've got to keep somebody in bandages for another 2 to 3 weeks, think of all the time and effort and money that's going to cost the clinic to do that. And also that means somebody else can't be treated whilst that's happening. But also to the patient, there's a huge social impact on that, and ultimately on the national GDP when people are remaining off sick for another 3 weeks each time. If you think of all those patients that are going into compression, it's a huge amount of money. So we need to get a little bit smarter at getting these garments quicker onto the patients. So there's a couple of dispensing options to go through. Of course, the first and foremost that most of us use and is always been around is our local pharmacy on the high street, absolutely essential, and they're there to deliver every prescription item that's available on the drug tariff, which means they're generalists and not specialists, particularly in compression garments. They normally link to GP surgeries, which has an advantage because those prescriptions can be put straight through. However, if those scripts are not written correctly, it can massively delay things. The patient can then go and collect those items once they've arrived, and they're able to offer advice in different areas because the pharmacists have got all those other skills for all the other things that are available on drug tariff. A second dispensing option is a specialist dispenser. And these can offer home delivery to absolutely everybody in the UK who has a UK address and or a clinic that's in the UK. They only do compression and the aids and gadgets that go with it. So they've got quite a lot of knowledge and expertise advice, and they're there at the end of the phone to help you fill your forms in properly, to talk to patients with particularly specific questions and advice. They have a communication direct link to all the manufacturers. They're not having to go through a middleman, and they understand the compression and they know the codes, and they're double checking of all the measurements before they go off to the companies to be manufactured and dispatched. They have a wide choice of manufacturers and they've access to all of those, and they've also got specialist knowledge in the different charges. You've already seen how different British standard can be charged as opposed to a lymphedema category garment. So let's move on to F of the MOFA. That's the fitting. So let's imagine in an ideal world we've now measured, we've ordered, and we've received exactly what we've asked for in a very, very short space of time. Fairyland. Not really. It does happen. We need to ensure that the patient can fit the compression garment and then apply it. So I'm now going to show you a video of how we can teach a patient to fit their own garment, and then they can then go home to enjoy being self-managing. How I would teach a patient to apply a stocking. So we've measured and we've now fit into a standard size circular knit stocking. So we've got the stocking on prescription, and that's arrived and it's the right size. So we're going to show the patient how to apply this, and then we're going to get the patient to follow those instructions and apply their stocking to the other limb. So firstly, what we need to do is to put our hand inside the stocking to get hold of the heel. And we do this just by reaching in, moving down until we get to the heel point of the stocking. And we then hold that in the palm of our hands and we turn the stocking inside out until we get to the heel point here. We then need to turn the garment around. So this is the front of the garment and the heel is here. And we're going to place this over the foot of the patient. We pull this on until we can feel the heel coming on at this point, and we know we can have a little peep to make sure that the toes are in place. At this point it might feel tight on the toes. That's okay because we can adjust that when we've finished. We then take the stocking piece by piece and we pull this over the heel. So if we get the patient to just lift their heel gently, and then we take the next piece, and again we're coming over the heel and we're coming up the limb. Again the next piece and we're coming up the limb, and then we get hold of the band and we bring this up to the leg, and what we want to do is to make sure we get to the point just below the knee where we have the two fingers, so we're not in the crease where we were before. What we do then is we need to make sure that this garment is fitting properly. So if we look here, we can see it looks a little lighter than it does here around the ankle. This means that we need to adjust the compression on the garment on the limb. And there's two ways of doing that. One, you can try and pick the stocking up and pull that and adjust it. It can get a little difficult with the elastic stockings. So I would recommend that you have to hand a pair of rubber gloves that have a very good grip on, because these are going to make your job a lot easier for application and for stocking adjustment. So I'm going to put my gloves on, and then all we simply need to do, making sure that we've got the stocking where we want at the top. We don't want to be pulling that up from that position. We want to be adjusting the garment from the ankle upwards. And if we just simply pull and rub, you can see that the garment starts to crease up the leg. You can see these creases. If we end up with a crease, we can just lift that and bring it back down. So we're moving the tension on the garment up the leg without moving the top because we've got that in position. If we find that we have a crease like this, we can just pick that up and lose it, and the rubber gloves just move and make that adjustment. There's two reasons we want to do this. Firstly, it's to ensure that the compression is graduated and even throughout the whole limb. And if you get that bit right, then the garment is likely to stay in place. Most stockings start to slip down the leg because the majority of the compression is down by the ankle. If we adjust it so it's even, it stays in place longer. We then need to turn our attention to the heel and the toe, and we need to check that the heel is in position. Again, it may need a slight adjustment, and your rubber gloves are in place to do that without any worrying about whether you're going to ladder the stocking. And then you would get hold of the top of the garment, get the patient to wiggle their toes, and then relax the stocking back down, and there, that should fit really quite nicely. One thing I always point out to patients is not to put these compression garments on like you would a pair of socks. It's only natural to want to do this with a compression garment like you would a sock. The minute you do that, you get absolute lockout, and there is no way you'll get your foot in there or able to put it on. So all being well, before the patient leaves the clinic, they'll demonstrate to you they understand the fitting application. So as you can see from that video, the rubber gloves are my favourite tool. They're sacred. They're not to go near the washing up bowl or the bathroom or the toilet. They are kept for your compression garments. The other thing to remember, and really is the take-home message from all of this, is please make sure your patients are able to apply their garments before they leave your clinic. If they've got a bilateral leg, you can see them apply it on their other when you've shown them on one leg. If they're only wearing it on one, you have to take it off and get them to reapply. It's the difference between somebody self-managing and not managing to do what we're recommending. Not everyone is able to just apply in that manner with a pair of gloves. So as you can see from the screen, there is a huge range of application aids that are available to help people put their compression garments on and take them off. When we use an aid to put a compression garment on, it's often referred to as a donning aid, and if we use them to take a garment off, we refer to doffing. Now, some of these products that you can see on here will help you do one or the other, and some of them help you do both. You need to establish with your patient whether they need both or just one to remove or one to take off, and work through the product range with them and see which best suits them, and that again will help them become independent or their carers to help them do that. This list isn't exhaustive, there's a huge amount out there, but the majority of what you can see on here is available on prescription, so they're there for patients to use and access. So let's go to the last section, to MOFA, for the aftercare. How to wash, how long to wear, and when to reorder. These are often questions that are asked, and you know, it's how long's a piece of string. Well, let me try and get that a little bit more succinct for you so that you can give some really smart advice to your patients. Here we can see the title washing instructions. Really, every time you have to follow the manufacturer's guidelines, because it's that keeps a garment in its warranty. It will tell you not to use a fabric softener. This degrades the fabric, and the laboratories are very, very sophisticated when you send them back if there's a problem, and they'll detect if you've been using a fabric softener, which will weaken the garment and the yarns. You can see the first picture is a garment that's just removed from a leg, and then the second picture here is when it's been turned inside out, and you can see it's covered in white dead skin cells. This has only been on 12 hours, but it's natural for us to shed our skin cells all the time, and when we're shrinking down a leg that's got a little bit of edema in it, you kick off a few more. Also, when you've got a black garment and white skin cells, it shows up even more. It's imperative you wash these inside out. You've got to get rid of all those skin cells. Keeping that the right way around without turning it inside out just locks those skin cells in that tight elastic fabric. The other thing it can do, potentially if it's not clean, is be an infection risk on your patients, and we really don't want to put them in that, because one of the main aims of our treatment wearing compression is to reduce the infection risk and cellulitis, particularly for those that have got a compromised lymphatic system. So how long do we wear our garments? Well, again, this is very individual and it's very patient and clinician centred. And it's about the goals. Where have you come from? Why are you wearing the garments? Are you putting these on because you've been in bandages that you've worn for 24 hours a day at high pressure with a stiffness that most people wouldn't consider with an elastic stocking? A lot of the compression garments say remove at night. Then if that's the case, that doesn't necessarily mean it has to happen if your goal is to keep something healed or keep the limb volume down. The only time when somebody shouldn't be sleeping in their garments is when they don't need to because their condition is mild, or when the garment has slipped and it's moved, or it's ill-fitting and it's uncomfortable. If it's going to cause damage, then it needs to be removed. So we can consider wearing them 24 hours a day for different patients. So it's again, what are those goals, what you're trying to achieve? If you want to prevent rebound, if you want to prevent re-ulceration, particularly in that initial phase post-bandage, then you need to consider 24-hour compression with the stockings. There's a new emerging market on nighttime compression and a few articles have been published on that. Many of these garments are not available yet on prescription, but I know the companies are working very hard to try and get this there for you. And we need to watch this space with interest because there's some great stuff on the market and in the wings ready to come out for people to have a different option. But that's a whole webinar in its own right, and maybe that's for another night. So when do we reorder? Well, we need to look at what the manufacturers are going to offer with their warranty. They will tell us that the guarantee on a garment is for 100 washes. So if we give somebody 2 stockings over 6 months and they wash one day, wear one the other, that gives us 6 months with 2 stockings, or 3 months with 1 stocking approximately. So when do we reorder? Well, if some patients are getting them every 6 months, we really shouldn't be waiting till we get to 6 months to put that prescription in, because we've already established that some people have to wait 3 to even longer, 4, 5 weeks to get their prescription. If we're taking that garment out of that 6-month warranty boundary, then we're out of warranty, and that's when we can start to see changes deteriorating within a leg, starting to get rebound with swelling. The patients will also tell you that the stockings don't feel half as tight as they did 6 months ago, and that's because the garment fabrics do degrade, they do relax. All materials will relax and have an element of hysteresis, but they are ready for changing at 6 months. So I would say before the 6-month mark, get the order in so that bang on 6 months you're fresh into it and you're not waiting to month 7 to be reissued with your stockings. So let's summarise our acronym of MOFA. We've done a full diagnosis, we've checked that they're arterially competent enough to wear the level of pressure that we want them to. So what's really vital is that accurate measuring, because that's what's going to make a patient feel comfortable when they're in the garment. Ordering, let's get the prescription right. There's the 6 holy grail tick boxes that I want you to keep referring back to. And then choose somewhere where you're going to get a reliable, quick supply and service for the garments that you want. Ideally not one that's going to take 3 to 4 weeks to arrive. Look at the fitting. Consider the patient and the carer. How do they fit? Are they happy? Are they cognitively able? Have they got the dexterity? Do they require an aid to put on, one to take off, or both? All these things need huge consideration. And also that often requires a second appointment. So it's not a case of prescribing a garment, right, I'll see you in 6 months. Invest in that second appointment so that you can make sure you get that right and you'll be happy, and most importantly, your patient's going to be happy. And that aftercare, get your aftercare right and you've got your self-care right. It just goes without saying. There's a reminder when they do need their next assessment or their garment to make sure that that's in the diary, in their diary or in your clinic for review. Don't leave it too late, and be mindful if you have to cancel a patient's appointment, if they're right on the brink of that 6 months, don't take them over that warranty period. I just want to share some useful resources with you as we come to the close of this seminar. As we mentioned before, the British Lymphology Society has a huge array of guidelines and articles and documents that you can use. Legs Matter, huge national campaign that's been lobbied at government level. TVN Together, Lipedema UK, really fantastic website with so much help and support for the patients who suffer with this disorder that's under-recognised and often misdiagnosed. We have the Lymphedema Support Network, a lifeline for many, many patients who have a chronic swelling, and the regular newsletters are there for, they're informative, and they do education for clinicians and for patients alike. And the Daylong magazine that's available for patients and distributed to all and sundry who wish to receive it. Again, I can't kind of finish this seminar without thanking Daylong for their support in this, and they have a website and telephone numbers for you to visit, and they are there at the end of the phone for you to ask questions about all the different compression garments and manufacturers that are out there, from the smallest question to the biggest complication. Use them, they're there for you. And of course, the products that are there, provided by these companies who work so closely with patients and clinicians alike to make sure that what they deliver is what we're asking for and what the patients require. They're excellent at providing support in clinics and coming out and visiting you, giving you their materials to make sure you're measuring properly and providing the garments appropriate to patients. But most of them offer a really superb education package alongside so that you can get involved in increasing your knowledge. So I advise you to visit their websites and ring their representatives up and ask for their support and help. They're great. So we'll now move on to our real-time question and answer session. Some of you hopefully will have been tapping away and lots of things will have popped up as you've been watching. And remember, you can take part at any time by commenting on the video, and they just keep coming through towards me. So we're going to move on to our first question, and I think that's coming through now. So question 1, now this is a good one to start with. Can I guarantee that the pressures on the box will be delivered on the leg? Good question. We've talked about the manufacturing process saying what that garment's being tested to, and that we can expect to get something within that range around the ankle. But how does that equate when we start to read in our research papers? Well, when we're looking at measuring compression next to somebody's leg, we use a different technique, and we're measuring the interface pressure. So we'll use a gadget like a Kuchenheim or a Pico press, and it's a little air bag that sits between the pressure, the garment and the limb, and it tells us what pressure is being exerted on that leg. Now remember, if we're measuring, where those are measured historically or generally is in B1 point, so that's higher than the ankle by about 12 centimetres, and it's just at the base of the calf. So immediately you can expect to have a slightly lower reading than what's on the tin of the compression garment, if you like. But also what you need to consider when you're putting it on a patient is the type of tissue that you're applying it to. Putting something on a hard, brawny, sclerosed limb is going to be very different to putting it on a limb that's got a lot of adipose fatty tissue or fibrosis. That fatty tissue dissipates the pressure, and it will read much lesser on that pressure point. We've also then, as we move up the limb, remember that the garments are made on a graduation, so we know we're going to lose the pressure as we get higher, and particularly as the limb will get wider, and that's Laplace law, which we can't talk about compression without mentioning that, so save it till the end. And we're going to go now on to question 2, and I hope that answered nicely question 1. So we'll go on to question 2, and this is Pamela in Buxton. Is either circular or flat knit better than the other? Well, Pamela, I think that goes back to what you're wanting to achieve when you put this on the patient. If you've got somebody who has got a sensitivity, who has got a misshapen limb, then putting something elastic on that is probably going to find a little nick and a little crease, and it's going to nip and find it quite uncomfortable for the patient. Elastic circular knits are, whether we like it or not, a little harder to put on than a flat knit garment. So again, it's about what tissue you're thinking you're putting it on. What do you want to achieve when you put that on? Is it to maintain? Is it to reduce? Or is it ease of donning, ease and doffing? So the one isn't better than the other. They work very differently depending on the tissue type and the aim of the treatment that you're aiming to go for with the patient. So it kind of, not a straightforward answer, Pamela, I'm sorry, but hopefully it just gives you a little bit more understanding that there is a difference and it's about what you want to achieve. So let's go on to question 3. I was taught to measure my patients standing with their foot flat on the floor to flex the ankle. Is it better to make them lie down? That again is a question that is not straightforward to answer, because some patients are actually not able to stand up. If a patient's able to dorsiflex and they're much more comfortable lying down, then that's absolutely perfectly acceptable. What can happen as well, if there's movement within the tissue, it can alter where those measurements are. If you decrease somebody's limb volume, potentially you're going to have a much more pliable, movable tissue, which actually might just kind of have a little bit of a hang when you stand up. You want to contain it in that situation. You want it to keep up and keep straight. So again, it's about looking at your individual patients, but also some manufacturers will tell you to stand and some will tell you to lie down. Actually, it's what's best for your patient, but knowing that you can tweak the way you measure by dorsiflexing the foot, and sometimes you might need somebody to help you do that and measure down. It's about protecting your posture as well. Not everybody's able to start kneeling down on the floor, and you might only be able to work on a height adjustable couch. So there's lots of reasons, so long as you understand why you're making what you're doing and checking with your manufacturer. So I hope that answers and helps your question with that. So we're down to our final question. Gosh, time's gone really quickly. So hi Joy, this is Joy Tickle, a familiar face on these Facebook Lives. And she asks, are there any ideas how we can persuade care agencies to get involved in helping patients to apply compression if they can't self-apply? They often are reluctant, but ideally a place to help. They absolutely are the people that are placed to help. And it's not a district nurse's job to go in and start applying a compression garment when they've done their work in healing. It is a care agency job when patients have only got this access. I would say, Joy, that the main way we can tackle this is education. And that might have to be a group local initiative. And there's opportunities to do this with companies. And you know, if we can persuade care agencies that if they take an education package from us, then they're going to be a higher profile. They're going to potentially get more customers, more people to help. And it's got to be a win-win situation. The patients are getting cared for, the care agency's got a good reputation, and we as clinicians are providing the education that we're trained and expected to do as part of our remit as nurses and physios and healthcare professionals. So I think it's education. So that's the final question. And now it just goes for me to say that I'd like to conclude our live training session, and thank you to everybody that's put your questions in. I'm sure there's a lot more that we've not been able to answer. Get them in, we're still there to answer, and we're going to get those back to you over the next 24 hours. So we're going to be typing away for a while now, hopefully answering all your questions. And I again like to take this opportunity to thank Daylong for giving us this platform to support this event, because it's a generic event. It's about these problems we're talking about are what every company and every product is there to kind of polish up and get smarter so that we can help our patients a lot better. To access your certificate of attendance, because hopefully you've all stuck with us and you've listened, I want you to follow the link on the screen showed now. I hope this has helped you gain a better understanding on how to measure, fit and prescribe compression hosiery. And it's going to be available for you to re-watch, and hopefully you've taken some top tips away. If you've enjoyed watching this event today, then honestly please keep up with the Wound Care Today Facebook page and give it a like, and you'll get then on the register to see what's coming up next. There's all sorts of things lined up for you. And I just, from a personal perspective, like to say thank you very much for giving up your Tuesday evening to hopefully help your patients be a little bit more comfortable and for you to feel more confident in your practice. Thank you. Bye.